Hi everybody, welcome back to Mobility RX. I'm Luke Chichetto and I'm here in Clearwater, Florida. And I'm following up on that last segment that we just videotaped and we sent out to you guys. I hope by now you guys are starting to see some relief within the back just by changing your stance, standing on that shorter leg. Again, it has to be a little habitual experience that you will, before it starts to see a difference. Like anything, when you're working out, several weeks after is when you start to really reap the benefits of it. That's from the muscular standpoint, roughly about 4 to 6 weeks before you start to see any real gains in what you're doing. So I don't want you guys to get false hope and give up on it that early. So really let it sink in and really let it take part in a new development of your livelihood. But today I wanted to talk to you and follow up with you guys and share with you another technique that is been out for 14, 15 years, and that is foam rolling. Foam rolling is one of the key components that I use here at Mobility. My clients come in, I teach them how to foam roll correctly. There are a lot of techniques that are used with foam rolling. Some roll on it quickly, some hold it. I prefer to do the static hold and release that fascia. And I will teach you a little bit about the fascia. I don't want to get into too much depth of that, but the fascia is a protective sheath. It looks like a spider web under a microscope, and it runs parallel to the muscle tissue. If we sustain an injury in the hunter-gatherer perspective that we are in, if we sustained it in the woods or somewhere where we didn't have the doctor to go see or get the injury fixed, the fascia would come in and it wraps around and it gets really stiff around that muscle, and it allows the healing process to take place naturally. Sometimes in our 9-to-5 jobs, prolonged sitting, or driving, or anything that we do that causes that stiffness to occur within the muscle, the fascia should be released, given that these wonderful scientific approaches now can help us further our livelihood into a better experience. So I wanted to share with you a couple of the foam rolling. I call them the bread and butter foam rolling of Mobility that I teach, and that's just rolling the back, and then rolling the IT band, and rolling the adductors. When you roll, I encourage people to masochistically look for the pain or feel for that pain when you're rolling on it. It is kind of painful, but it does dissipate the more times you do it throughout your days and throughout the weeks to come, because it starts to release and it doesn't rely on, oh, I need to tighten up and protect and protect and protect. When you roll over that tissue, it releases and it allows the elasticity properties within the muscle tissue just to act accordingly. So I'm going to share with you the three or four that are most important, in my opinion, to relieving the low back and getting you feeling a little bit better. Okay guys, here I am back. I'm going to show you the exercises that I use with these foam rollers. If you're not familiar with the foam roller, all it is exactly what I was saying. It's made out of foam. They sell them pretty much everywhere now. They've been out for a long time, 14, 15 years, maybe even longer. But they're just a round tubular. This is actually a 3-foot piece of foam, 6 inches in circumference. And all you do is you roll your body parts on this to release that fascia that I was telling you about. When that fascia is released, then you regain the elasticity properties of the muscle back in to allow that range of motion back into the joint, hence mobility comes back, then stability, you can regain stability within that region as well. So just to give you a brief rundown of the main ones that I am constantly telling clients here, it's an effective way to get better quickly is because if the muscle can't move, then you can imagine you have that very hard stiffness in there, and if that stiffness is occurring, then it's pulling on that joint and causing you more discomfort. So if some of you need a softer one, this is kind of medium. They make one that's even softer than this, but this is probably the main one. Like I said several years ago, and this is a brand new one, but several years ago back when I first started, this is the only one that was introduced, was a medium dense one that I can recall anyway. I use a black one, which is behind me right here. I'm going to demonstrate on. I use the black one. It's a little bit harder foam, a little bit. I guess the density is a little bit thicker, so it doesn't give as much as this one. Again, this is kind of medium, not too squishy, but anyway. So if you can pick up a foam roller or something that you can roll on, they make them in all different shapes and sizes now. Some of them have bumps on them and releases different tissue. I don't encourage any of that till you get familiar with it, but if you're used to it, by all means, try all the releasing that you can to continue to get your livelihood back, continue to keep that fluidness back into the body. Okay, so I'm going to demonstrate the main ones that I do. I'm going to do them fairly quickly so you understand where they're coming from, and if you have any further questions, you can just email me. That's mobilityrx@gmail.com, and we can discuss it further. I'll continue to post videos in conjunction with this video to better your life, get you back on your feet, and continue to eliminate back pain. Okay, so the first one I want to show you, roll that one out of the way. First one is for the low back. And again, this is a little bit more dense, so I'm just going to roll on it and show you how I perform the low back. There's many ways to roll the fascia. Okay, this one is just roll all the way out onto it, roll it back down. You get comfortable, you go at your own pace. You will get some manipulation from the vertebra, which is perfectly common, normal. I don't want to scare anybody by that. This is one that is recommended for any one of my clients, given even some people that have fusions and whatnot. Again, I want to make clear though that if you have some problem with your back, please consult with your physician prior to doing this. So here we go, there's the back. The next one I want to show you is going to be the IT band. Now the IT band is just it's the iliotibial band. It's an abbreviation for a tendon that's connected to your glute and connected down towards your knee. Now when that is released, it's a slow release. You cannot stretch the iliotibial band. The IT band can't be stretched out per se, like stretching your forearm or your bicep. Okay, so the foam roller helps with this. This is going to be a very good area to roll. Because of that factor, it's not getting a lot of releasing throughout the day. So rolling the IT band is one of the key factors on keeping that low back from seizing up or tightening up. Now prop up on your hip. Okay, a lot of people teach it differently, which all techniques probably work as long as you're doing it every single day. You're trying to get some release from that. But the one I teach is a very slow roll. Slower is actually better. Your counterbalance here to the opposing leg and my opposing arm. My elbow is on the ground and then I just roll. So I'm going to start at the top of the hip and I'm going to roll down towards my knee. Now, masochistically, as I was saying, you kind of reach and roll for some type of discomfort. When you feel that discomfort, that's when you want to sit on it and stay on it, okay? So now I feel a little bit here. I'll just go ahead and sit here for a little bit and allow that to release. Now I'm not going to do the whole leg because I want to show you the other exercises to do, or releases to do rather. Okay, so here I am, I'm releasing it. Okay, it doesn't feel that great. Now it's released. You'll feel it kind of dissipate a little bit, and then you move to the next spot. Make sure you roll all the way down to your knee before you're done. Okay, just for purpose of showing you, you go all the way down to your knee right here. Now you can stop, and you can do the other side. Okay. So now the other one that is an area that I think is one of the vital areas of keeping the low back from seizing up and keeping you in a fluid manner would be your quadriceps, the front part of your legs. Okay, so that one's done as well. All of these are done from a static hold. Okay, now I'm going to widen my heels out, my feet are out wide, and I'm going to roll, again, I'm going to roll slowly up from the top of my quad all the way down to my knees. I'm going to use my forearms and kind of army crawl through and pull myself down. As I find a spot, again, I'm going to sit on it, hold it for about 10 to 15 seconds, and then I'm going to roll again until I get all the way down to my knees. Okay? That's release number 2. Number 3 that I found a vital area is the adductors. Okay, that's the inside half of your leg. Now this is done when you're performing this one, it's going to be on the inside, okay? And you want to prop all your weight up. Sometimes you can bend your knee. Sometimes you propping it up, turn your internal rotation, lifting your heel up, internally rotate that femur will help get some more release out of this. So here I am, I'm releasing, turn my heel in, there we go, I feel a little bit, I'm going to stay on that, okay? And I'm going to release it all the way down until I get to my inside of my knee. Excuse me. And the last one that I recommend you guys to get used to is your calves, okay? So if I can put as much pressure on that calf as possible, you're going to be able to get in. Releasing this calf is going to allow the larger muscles to function properly when you're not sitting in a position all day long, okay? Well, and that's another segment. We'll get up into some of the exercises pertaining to getting into a good squat. So here I am going to put all of my weight, use my opposing leg, push down on the calf, prop my body up, and work my way down to my ankle. You can start in any direction. You can start from the bottom of the ankle and work my way towards the upper half of my calf. Okay, and I'll give you a little lateral view, just like the other ones. See how that works. Okay, so here I am, I'm releasing this calf, releasing my left calf, I roll down. Okay, I feel a little bit of tension, I sit there for a little bit, hold that. Okay, so those are the main ones I wanted to cover today in this segment about fascias and lower back. There's several more that I will talk about and continue to go as we go forward with these videos. I hope this is helpful. Again, I look forward to seeing you again on the next video.